Hello, I'm Dr. Dominique Dempah. I'm a general surgeon with LewisGale Physicians. My emphasis is foregut surgery, which means the upper part of the abdomen, which includes the liver, the pancreas, and the esophagus. When we do a cholecystectomy, if the patient had symptoms that were on and off, which is the most common way that they present, the symptoms are not constant, but they're on and off, and they are bad enough that they disturb your daily life. Those would be what we call outpatient procedure. So the patient will get the procedure and go home the same day when we do those laparoscopically and robotics. Again, after discussion with the patient on which route we're going to choose, some patient may benefit better from a robotic approach with a single site incision, which means you only have one incision around the belly button. Some other patient will get a laparoscopic cholecystectomy, would be 3 to 4 little incisions. Those technique will minimize your pain, and if you came in as an outpatient, then you'll be able to go home the same day. On the other hand, some patients have severe gallbladder attacks that requires them to go to the emergency room department, in which case the recovery may be a little longer, not because of the procedure, but because they were already sick from the disease process. And those may spend a few more days in the hospital. But the trauma of the surgery is minimal. After cholecystectomy, which is the removal of the gallbladder, the patient is essentially able to have a normal diet. That being said, immediately after surgery, your body has to get used to not having the gallbladder. And one of the main functions of the gallbladder is to break down what we call the fatty acids or the fatty foods. So until your body gets used to not having the gallbladder, which usually takes a couple of weeks, we recommend that you avoid a high content of fat in your diet, because then it can lead to some diarrhea. But past that period of adaptation, most patients resume a normal diet. And frankly, most of my patients, when I see them in the office, they tell me that they usually kind of get back on a regular diet even before those 2 weeks that I recommended.